In several countries, including Germany and the USA, colonoscopy is recommended and offered as a first-line tool in population-based colorectal cancer screening. Across Europe, it is also frequently employed as a secondary tool to work up positive alternative tests. After removal of screen-detected colorectal adenomas, colonoscopic surveillance is necessary. The recommended surveillance intervals vary according to findings at screening colonoscopy. Commonly, a surveillance colonoscopy after 3 years in cases of high-risk adenomas and after 5 or more years in cases of low-risk adenomas is considered appropriate. Exceptions with earlier surveillance include removal of adenomas in piecemeal technique and incomplete removal of adenomas. Additional colonoscopies shortly after screening might also be performed due to signs and symptoms of gastrointestinal disease. Surveillance is likely to impact substantially on the effectiveness and cost-effectiveness of screening programs in preventing colorectal cancer incidence and mortality, particularly in mass screening. Therefore, it needs to be organized efficiently. An important aim at the patient level is to minimize additional discomfort and pain, as well as the risk of severe adverse events associated with surveillance colonoscopy. A recent review concluded that more studies are needed to better define which patients are at low risk for advanced adenoma recurrence. In Germany, screening colonoscopy has been offered to average risk adults aged 55 and more years since 2002. Several studies have recently evaluated colonoscopy use for screening or diagnostic purposes in the general German population, but so far little attention has been devoted to adenoma surveillance. Stock et al. Recently observed that 16% and 31% of 939 screening colonoscopy participants had an additional procedure within 3 years and 5 years respectively. According to a cross-national survey, Germany generally appeared to have relatively high levels of lower gastrointestinal endoscopy use compared with several other European countries. The authors explore utilization and findings of additional colonoscopies performed within 3 years after screening colonoscopy in routine practice in Germany. They present the results in their paper entitled Performance of Additional Colonoscopies and Yield of Neoplasms Within 3 Years After Screening Colonoscopy, a Historical Cohort Study. This is what they have to say. Background and study aims. After screening colonoscopy, additional colonoscopies may be required for adenoma surveillance or diagnostic reasons. The aim of the present study was to explore their utilization and findings in routine practice. Patients and methods. The study comprised a historical cohort of individuals participating in colonoscopy screening in 2006. Utilization and yield of neoplasms of additional colonoscopies performed in these individuals by the same physicians, less than 6 months and between 6 and 36 months after screening, between 2006 and 2009 were assessed, using data of a colonoscopy quality assurance program in Bavaria, Germany. Screening including polypectomy and short-term follow-up colonoscopy was assumed to have been completed within 6 or less number of months. Multivariate logistic regression was used to identify predictors of additional colonoscopy and advanced neoplasms, high-risk adenoma or colorectal cancer among those with additional colonoscopy during the period of 6 to 36 months after screening. Results. A total of 51,301 individuals undergoing screening colonoscopy were included. Of these, 10.1% had an additional colonoscopy performed by the same physician between 6 and 36 months after screening. The percentages of those with additional colonoscopy were 5.7%, 18.6%, and 33.7% after negative screening, low-risk adenoma at screening, and high-risk adenoma at screening, respectively. The overall findings were negative colonoscopy, low-risk adenoma, high-risk adenoma, and CRC in 68.6%, 6.7%, and 0.6%, respectively. Younger age, male sex, screen-detected adenomas, inflammatory bowel disease, and early repeat colonoscopy within 6 months were predictors of additional colonoscopy. Older age, male sex, screen-detected adenomas, and surveillance indications were associated with increased risk of advanced neoplasms at post-screening colonoscopy. Conclusion. The results indicate frequent utilization of additional colonoscopies along with substantial adenoma yield in the first 3 years after screening colonoscopy.